Good morning, guys, and welcome back. So in our last video, we talked about pediatric calculations, and that was based solely on the child's weight. So now we're going to be talking about the body surface area, and this is based on the child's height and weight of infants and younger children. I've taken the exam like 3 or 4 different times, and I finally passed it on my 4th time over 7 years, because I had a lot of things going on in my life, and I finally passed the exam in 7 years. So that's why I'm passing down my knowledge on how to pass the PTCP exam. But this is one question I have never seen on the exam, but you could get it just in case, because there are 5 different versions of the exam, and you never know what exam you might get a surprise on. So the body and surface area is based on a child's height and weight of infants and young children. It's used to determine medication for patients undergoing open heart surgery, chemotherapy, and radiation therapy. Many physicians and pharmacists use the West nomogram as a quick reference to help calculate the dose. The West nomogram places a dot on the patient's height and weight and draws a straight edge line between the 2 dots. The place the line crosses the M2 column reveals the patient's body surface area. But you want to make sure you're always careful to place the dots correctly depending on the metric and household measurements, because it will determine an incorrect BSA for the child. So I'm going to show you an example of what the West nomogram chart looks like, because it's easier to see a picture than actually seeing it drawn out. So this is what the West nomogram actually looks like. As you see here, this is the height of the child. This is the weight of the child, and this is the BSA. So once you place the dot on the chart, you're on the height and the weight, you're going to take a ruler or a straight edge and draw a line straight across, and in the middle is going to be your BSA. So that's why it's really important to understand and how to draw a straight line on this graph and make sure that line is accurate as possible, because a lot of physicians and pharmacists use this graph to help determine the BSA for a child. So the steps to calculate the patient's BSA, you want to calculate the patient's BSA, which is number 1, and then you want to calculate the desired dose. So it's going to be the dosage order times the BSA equals your desired dose. Number 3, confirm whether or not the desired dose is correct. If not, consult with the physician who wrote the order. So if the BSA is not correct, you want to consult with the doctor on who wrote the order. As a pharmacist, the pharmacist would do that, not as a technician. Number 4, calculate the amount to administer using a fractional equation, ratio proportion, or the formula method. So in this video, we're only going to be talking about the formula method, because this is the most commonly used. So the pediatric dose formula is BSA, or child M2, over 1.7 M2, which is the average adult BSA, times the adult dose. In most questions, in most scenarios, you will be given the child's M2 and the adult dose. So I have an example on the back. So the example I have is the child's BSA is 0.65 M2. The recommended adult dose is 275 milligrams. Determine the child's dose. So you want to plug everything into the formula. And the formula again is BSA, or child at M2, over 1.7 M2, which is your average adult BSA, times the adult dose. So we're plugging everything in from the question into our formula. 0.65 M2 is the child's, 1.7 is the average adult, and then 275 milligrams is the adult dose. So once you divide 0.65 divided by 1.7, if you have your calculator, it's going to be 0.38. And then you want to take 0.38 times 275 milligrams. And that's going to equal 105 milligrams. So your pediatric dose is going to be 105 milligrams. Just again, guys, this is just a short video. But it's rare that you will ever see this on the exam. I'm just throwing it out there because we still have to learn and know it. But if you have any further questions or concerns, please leave your comments in the comment section and I'll get back to everyone as soon as I can. And if you'd like to follow me on YouTube, it's Lauren Clark 1971. It's at Lauren Clark 1971. I have all my videos posted there, also on my TikTok account. Thank you and have a great day.